The patients that are going to think it's new or invasive are those who really don't know that much about it. It helps to point out that there have been over 375,000 of these implanted. There's one in 2013. There's one every 6 minutes implanted across the world. I happen to have had tons and tons of experience, so I tell patients that my own personal experience goes back to the days of the FDA trial, and even back then we saw that it was such a superior procedure in terms of the visual outcomes, but especially so for those patients that didn't qualify for anything else. In terms of the invasiveness, the only way in which it can be perceived to be more invasive is the fact that it's intraocular as opposed to extraocular. For example, LASIK and PRK are only done on the surface of the eye. ICL obviously involves making an incision into the eye, but that incision is a lot smaller in itself than the entire amount of tissue that you're incising for the corneal flap, for example. You're dealing with a 2.9 incision as opposed to centimeters of an incision. So patients, I think once you have that discussion with them, it goes a long way to calming their fears. But the surgeon also has to be convinced. If the surgeon's not convinced, it's going to come across. And I would much rather deal with that patient from the level of conviction that I have, as opposed to feeling a little whiffly and waffly about things. And if you're not convinced, you need to get there first.